All right, good afternoon, ladies and gentlemen. Welcome to Labor Health Committee meeting on a Friday afternoon. Starting a little late, we do have more time. The majority floor leader gave us a little extra time in case our bills go long. We have three bills. We're going to do the continuation of House Bill 121, and then we have two additional bills. I think for the edification, there were only two of us here when we heard the public testimony, et cetera, on House Bill 121. But I think it would be fair to allow the three members who were not here, if they had any questions for the prime sponsor, let's give them that opportunity if there's any questions or things they would need from the prime sponsor. So Representative Singh, if you don't mind introducing yourself, and then we'll see if there's any questions from the committee. Thank you.
Thank you, Mr. Chairman. My name is Daniel Singh. I represent House District 61. And so we're just continuing the conversation about House Bill 121, hospital pricing transparency. We had a number of folks talk about the issue from a lot of different perspectives. And so if you have any questions, I am here to answer them. Thank you.
Thank you. Senator Scott.
Mr. Chairman, frankly, the reporting appeared to be very well done in that part of the bill. To what extent does that mirror the federal reporting requirements? Is it materially different? Is it the same? What's the relationship there?
Representative Singh.
Thank you, Mr. Chairman, Senator Scott. So the big difference in this bill from what exists in federal rulemaking right now is the dollars.
Hold the mic a little closer, please.
Got you there. Sorry, Senator Scott. So the main difference in this bill from what exists in federal rulemaking would be the dollars and cents aspect of this. And so it would require that this menu that is available from hospitals would have the actual dollars and cents amount available to consumers. That is probably the biggest significant difference from what exists in federal rulemaking. But the point of the bill really is to make sure that we have a set of standards from the state of Wyoming's perspective, regardless of what the federal government does. I do believe that this is a consumer protection type of idea, and so that's really the intent of bringing this bill.
Senator Crum.
Mr. Chairman.
Senator Crum, please.
Yes. First off, Mr. Chairman, I appreciate the testimony. I did get a chance to watch the video or whatever you call the thing that's done from here. So I do appreciate all that. But my one question, Mr. Chairman, really is, I understand there's a few different things in here than the federal reporting. But there is a lot of federal reporting going on right now. We've got, I guess I'm making a statement, and that's going to lead to the question, is on many of our hospitals, in fact, most of our hospitals in the state right now are losing money. And my big concern on this bill is adding more layers of, I hate to use the word bureaucracy, but I'm going to use a bureaucracy onto our local hospitals and the people in the hospital, where they may have to hire more people, cost more time. And where that really goes then is who pays for that is the consumer, which is the person we're trying to protect with the bill, which I very much appreciate that. If we, Mr. Chairman, do we know what additional costs would be on our local hospitals and providers with this bill and the time that it would take to meet these requirements? That's my question, Mr. Chairman.
Thank you, Senator Crum. Representative Singh, if you want to respond to that, thank you.
Thank you, Mr. Chairman, Senator Crum. So for the first part of your question there is an additional, I believe it's $19,000 to the Department of Health that this particular task would require. It is an additional requirement from the Department of Health, and it is the oversight of these menus that would be provided by the hospitals. The bill is really intended to complement what is being done on a federal level, and so while it does require additional information, it's not necessarily a particularly burdensome requirement for the benefit of the consumers. And so this does require the monetization of the Department of Health to oversee what exactly is being done on these menus, if that answers the question.
Further, Senator Crum? Okay. Senator Hutchings?
Thank you, Mr. Chairman. Representative Singh, I went online and looked at our hospital here, and it's like, how do I find this list? So down at the very bottom, I see price transparency. I click on it, and then there's a spreadsheet, and the spreadsheet is just, ooh, it's daunting. It's like, whoa, what's going on here? So what I did is I tried to find how much would a Band-Aid cost. And I found Bandage, and I think it's $789. The difficulty I think I had in finding out prices, this is what this bill is trying to clear up. Now, I did find things like, okay, I want to have a knee surgery. There's one physician that does it, click, he does it for $400-something or something like that. And then when you click on it for details, you don't get a lot of the bedpan, the soap that they give you, the toothbrushes. Every pill is going to cost you something. Again, is this what you're looking for, or the patient should be looking for on this list?
Representative Singh?
Thank you, Mr. Chairman, Senator Hutchings. So the intent of the bill here is really to make sure that the procedures from the hospitals are entirely transparent beforehand to the patients, and that patients are able to shop around if they intend to for those pre-intention type of operations. And so I do believe that every single one of those types of transactions should definitely be available to the end consumer. But I do understand that there are variabilities to how each of those supplies, each of the supplies may be distributed to the individual hospital. So I do recognize that there is variation in that. And so that would be something that is reflected as a result of the bill, that you would see that there are differences in supply and demand to each individual hospital. And then each of the consumers would be able to make their decision based off of informed consent.
Thank you. Follow up. Senator
Follow up,
Hutchings.
Mr. Chairman. So quickly, the bandage is not that important, but the procedure is the main thing that you're looking at.
Representative Singh?
Thank you, Mr. Chairman. Senator Hutchings, yes, that is what I'm looking at the end of the day, though I do think it would be incredibly important for hospitals to be transparent about how much they're charging for individual bandages.
Thank you. Further questions? Further questions? I think, yeah, Senator Steinmetz, my apologies.
That's all right, Mr. Chairman. Could you just take us through the, because I wasn't here, so I apologize, and I didn't watch you on TV. So just take me through kind of how this collective action of debt against patients by non-compliant facilities, could you just take me through what that is intended to do?
Representative Singh?
What page?
Page 22 is where it begins and then goes on.
Representative Singh?
Thank you, Mr. Chairman, Senator Steinmetz. So this portion of the bill, it's really intended to protect those consumers who may not, they were never provided the opportunity to have an informed decision on the type of procedure, the cost of the type of procedure that they would have. And so this would, the portion of the bill is to require that opportunity for the end consumer. And so hospitals would have the ability to issue a bill, but they would not be able to collect on it. That is the intention of the bill here. So if people did not have the opportunity to even look at the price itself, that it wouldn't be forcibly collected upon. They would be able to have an argument in that process.
Senator
Well,
Steinmetz?
thank you, Mr. Chairman. So I'm just trying to figure out how that works. So are they in compliance if the list is just there? How do you verify whether the customer knew that or not? And then secondly, I'm just trying to think about how this works in the real world because my husband is an insurance agent and there's a lot of issues as far as someone will come in and something's miscategorized from the billing code at the hospital, and so they're trying to bill the client rather than the insurance company. So what is the interaction between all of that? Because I see that as a very confusing web to then insert debt collection into.
Representative Singh.
Thank you, Mr. Chairman. So Senator Steinmetz, this bill isn't intention to somehow dictate the actual implication of the costs for insurance companies, or necessarily the practice that has been required by the hospital, whatever they choose to do in a medical procedure. But this is simply to make it transparent to the customer, the end customer, as to the actual cost of whatever it was that was instituted. If that answers your question, I'm sorry.
All right,
Thank you. More follow-up?
well, that's all right. Thank you, Mr. Chairman.
Thank you. Senator Scott.
Mr. Chairman, does the collection prohibition include a prohibition against trying to collect from the insurance companies? Or is it strictly limited to actions against the patient themselves?
Representative Singh.
Thank you, Mr. Chairman. This is intended against the individuals themselves.
Just the individuals?
Yes.
Thank you. Further questions? To that point, I do think there is some challenges in that same section between what's prohibited on page 26 and then what's actually called for on page 22, 23. So there is some, I guess, I think some conflict there that I'm not sure I can rectify quick enough. So anyway, further questions for Representative Singh? Further questions? Thank you, Representative Singh. With that, we took public testimony last meeting. Maybe feel like it was last week, but it was just last meeting. So we'll close public testimony. And committee, what's your pleasure?
Move the bill.
There's a motion by Scott. All right, let's just walk through the bill. I think it's a long bill, so we'll do it in double pages. Page 1 and page 2, 3. Page 4, 5. I'll just make a comment here. I think it is for every particular thing that a hospital does, from the bandages to the services, et cetera. I don't think that there is this bill particularly standard charge. Page 6, 7. Excuse me. Page 8, 9. Page 10, 11. Page 12, 13. Excuse me. Page 14, 15. Senator Hutchings, if you use your microphone, that'd be great.
Sorry, Mr. Chairman. It looks as if on page 15, facilities are doing what at least the one that I looked at. But just the difficulty of figuring out what was what and having things like he asked a little bit further back in a prominent location. So I'm wondering about the reporting requirements that each time a facility updates the list, it's required by this statute. It seems like it's out there. that they shall do this. And I just want to maybe clarify again, they're doing it from the federal level, but we're codifying it on the state level. Is that what you got the other day?
Senator Hutchings, I guess I can only read, this is state statute. I think that that is accurate. I would point actually back to page 11. It talks about the list up from this section has to be not less than annually. So there's at least in subsection G, talks
Gotcha.
about an annual list. What this one talks about is if they update it, if they change the list, then it needs to be subsequent to that, whatever changes. So I think the comment was made, just to be clear for the committee that weren't here, it could be daily if things change daily.
Gotcha.
So,
All right.
all right, anything else on 14, 15, 16, 17? Set 18, excuse me, 19? '20, 21. So, colleagues, there's a split on page 20 into 21 regarding the civil penalty. The civil penalty is different for a critical access hospital, i.e. less than 25 beds versus a hospital. I understand that was an amendment that was placed on in the House. I guess I'm not convinced that the finances are that much different between some critical access hospitals and other hospitals. I'm also not convinced that just looking at the critical access hospital, if you have 3 offenses, i.e. 3 offenses at one time, it looks like could be eligible for all 3 fines. First offense, second offense, third offense. I don't know if I know maybe that's not the intent. I'm just saying potentially a plain reading says they've got 3 material violations. Are they now a critical access hospital when we're trying to protect? Could they be then liable for the most? So I'm pointing that out. What I would like to do is, and I'm going to do it conceptually for tonight, I would just say, shall impose a civil penalty of $100 per day, et cetera, regardless of what kind of facility it is.
Gotcha.
So I'm taking the lower end, not going to 500 or 1,000. I'm just taking the $100, applying it broadly across all the facilities. That's a motion on my part.
Mr. Chairman?
Discussion on the motion.
Yes, Mr. Chairman.
Senator Crawford.
I think that's a wise thing. I mean, we're talking about thousands and thousands of items, and not that they're saying malicious, but like you talking, the other good senator down at the end, a Band-Aid, we got 4 sizes of Band-Aids, and probably 10 sizes really, but yeah, I just think 1 penalty a day is plenty. So I agree with your
I'll second it.
motion.
I'll second it.
Further discussion? Senator Scott? All right, so I'll work with, but I think there's a pretty easy way. It'll be striking the language on second and third offense, and then the language on the top and just saying any
Let it be
facility
that.
is $100 per day, each day, for basically not being in material compliance, and that's defined elsewhere.
Gotcha.
So further discussion on the amendment? Further discussion, seeing none, all those in favor of the amendment, say aye.
Aye.
Those opposed, no. Amendment's adopted. Continue, anything else on page 20? Page 21?
That helped.
Like I'm talking to the chairman, sorry. I've never seen the legislature tell the department they should propose the legislation. So does anybody want to make a comment on the bottom of 21, top of
Let's see
22?
that.
Mr. Chairman, being
Senator
that-
Scott, have you ever seen that before?
No.
I haven't paid any attention.
Well, come on.
I have seen it before.
All right, well,
Mr. Chairman, I don't think it was proposed legislation, but it's usually come back to us with you know, a
Recommendation.
recommendation for legislation for like an ECA or something like that.
All right, fair enough. All right,
But-
we'll go on to page 22, 23.
Page 22, Mr. Chairman.
Senator Scott.
Amendment on page 22, line 12, after facility, put in excluding a county memorial hospital or a hospital funded by a hospital district. So we would exclude the publicly owned hospitals.
Where's he?
Mr. Chairman,
Please, Senator Scott.
I would move that. The reason I want to do that is that I think our community is served by both a large outside hospital and by a county hospital from out of county, actually. And the problems have been all with the large one. They can have very aggressive collection procedures against individuals, which is what this is talking about. Don't overestimate this provision, because it does appear, and I understand from the testimony, that it allows for collections against the insurance companies, and that's where most of the money's coming from. But I'm afraid that we need to deal with the very aggressive collection procedures by a hospital that's not locally owned or publicly owned. So that's why I want to put that in.
All right, further discussion on Senator Scott's amendment. We'll have some standard language that we'll ask LSO to bring in there, referring to the particular
Yeah.
County Memorial Hospital statute and the hospital district statute. But we'll work on that. Senator Hutchings on the amendment.
Thank you, Mr. Chair. Was that line 15 through 19?
It was after, on page 22,
Right.
line 12, after
12.
facility,
Okay,
comma, facility, comma, excluding a county memorial hospital or hospital district, and we'll get the
Or a
proper.
hospital funded by a hospital district. And,
Okay.
Mr. Chairman, that's important in case the district is not operating the hospital and really funding it.
Thank you, Senator Scott. Actually, I think we allowed a rural health care district to also operate a hospital
Okay.
in statute, so we'll make sure it's inclusive.
Yeah, okay,
We'll
that's
make sure
fine.
it's inclusive. Any special district or county memorial that can operate a hospital, we'll make sure that's included.
Okay.
Further discussion on the amendment? Further discussion? No? I guess I'm gonna comment. I certainly understand the intent.
saying?
I don't know how many county memorial versus hospital districts. And to be clear, I'm not sure that the hospital in your county, community that is that large one is not still a county memorial.
No, it's not.
ours is a
It's
county.
just being operated by.
They sold
Yeah.
it.
They sold it, okay.
Yeah,
It is not.
Okay, all right. All right, further, any other discussion on the amendment?
nope.
All those in favor of the amendment say aye.
Aye.
Those opposed, no. Amendment is adopted.
Mr. Chairman, on
Please, Senator.
page 22, that alpha section where it's saying that let me see, any facility that's in non-compliance, is this saying that for
Senator,
the,
could you tell me where you are again? I'm
page
sorry.
22, alpha down there on line 15?
Okay, thank you.
Okay, attempting to collect a debt. It seems like this is talking about the aggressive move that the senator, to the right of you is suggesting. They can't immediately go to the patient and start a debt collection. Give them time to pay, is that kind of what he's talking about, instead of the really aggressive going after the patient? Is that what you're saying?
Senator Scott,
Mr. Chairman, the experience we had when the hospital was locally owned and controlled locally, and the experience with the other outfits since, is that they were able to usually work out a deal with the patient. And then when the new hospital came in, it went back on a whole bunch of those deals.
Gotcha, gotcha.
And there's often a negotiation based somewhat on the ability to pay when the insurance doesn't cover everything.
Okay, excellent.
Mr. Chairman,
Thank
Senator
you.
Crum.
just a question when I read that, if you're out of compliance, then you're not going to be able to collect debt directly from the individual, which, again, I get back to that local hospital. They may be out of compliance for, I'm going to keep using Senator Hutchins' example of a Band-Aid not reported correctly. and they can't collect the debt, the hospital's going broke anyway, and now you've hurt their cash flow more by not allowing them to collect the debt. There's good debt collection, and then there's unreasonable debt collection, right, where you're putting, but debt collection's an okay thing. I mean, you use the service, you should pay for the service. So I am concerned about not be able to collect debt in a timely manner, because the longer debt goes too, the harder it is to collect, you know, the further you're away from the service, the less meaningful it is to you to pay the debt.
So this was not a question I had earlier, but the discussion has brought it up to me. On line 16, it talks about attempting to, going from collect from a patient or patient guarantor. Is an insurance company a patient guarantor?
He says no?
I don't think so. I think that refers to some other individual who's a guarantor. I don't think an insurance company guarantees any payments by the individual.
Thank you. We're not sure.
He's gonna have to run this bill.
All right, further amendments, or further discussion amendments 21, 22. 23,
I guess I'm sorry.
go ahead, Senator.
I'm
Senator?
sorry, I go back to line, page 22, and then 15 through 19. I'd make a motion amendment that we would delete that, all of A there. I just have a hard time where a hospital can't collect its debt. We're damaging those local hospitals, especially the smaller local hospitals. We're damaging them, so I'd make a motion that we delete all of A.
So what would be remaining was they could not sue the patient or enforce arbitration, or I just want
Yes,
to make
sir.
sure I understand what's happening. Or indirectly or directly or indirectly cause a credit report or report to a credit reporting. So the motion would be to strike A. There's still two remaining things, so those would be renumbered.
Reasonable compromise.
Yeah.
Any
And then still,
discussion?
which then still a penalty to the hospital, right? Because then they still aren't able to directly, affect the credit report, which is a hammer, right? I mean, and then you still wouldn't be able to sue the patient, so you gotta get compliance to sue them. But you're still able to go out and work out payment plans, call them on the phone.
Yeah.
Those type of things. I think that's reasonable.
Okay, just further discussion? Further discussion? None, all those in favor of the amendment striking A, which is lines 15 through 19, please say aye. Aye. Those opposed, no.
No.
Amendment is adopted. On to page 23. Page 24, 25. 24, colleagues, lines 13 and 14. I wasn't quite sure what the debt shall not include debt for business, investment, commercial, and agricultural purposes was doing here.
Yeah.
So unless anybody has a reason why it should be here, since this is all about healthcare, I'm going to suggest we strike that. Debt quote, the quotes,
Yeah.
debt through purposes. Be some, anyway, discussion on that? Discussion, seeing none, all those in favor say aye.
Aye.
Those opposed, no. Motion's adopted. Anything else on 24, 25? I would draw your attention to the bottom of 25, top of 26. And this is a court has found out of compliance, and there's a refund of amount of the debt paid. And then there's a penalty that's twice the debt. So, and this is coming from the facility. So I'm not sure how we should maybe, I don't know how to deal with that one. Any thoughts on that one? Remember, I would believe this is not for improperly paid claims. This is for the entire claim, potentially. And this is about just being material out of compliance, not whether the charges are reasonable and prudent, et cetera.
That's interesting. Shall we find,
It's a sledgehammer, all right.
yeah.
Mr. President, or Mr. Chairman.
Please,
sorry,
Senator.
Mr. Chairman. As you read that sentence, in an amount, on line 1, page 26, line 1 and 2, and it says in an amount equal to the total amount of debt. It seems to me if they're out of compliance, I keep using the Band-Aid, but the Band-Aid, and they just went in and had open heart surgery that was a $250,000 thing, and we're not gonna allow them to collect the $250,000 because of Band-Aid. That doesn't make sense. It just doesn't make, the penalty doesn't fit the crime, if you wanna put it that way.
Is there a way we can, Mr. Chairman, at
Yeah, Senator Hutchings.
25, page 25, line 22, can we just stop it at the debt the payer has paid, period? And can we delete the rest of it? Would that
Yeah, so
make
if
it work?
your amendment is to strike, excuse me, page 25, line 22, after
Just-
paid, strike the remainder of the line, and strike the page, line 1 and 2 of the next page.
Would that work? I don't know. So,
Mr.
refund
Chairman.
the payer any
Senator
amount
Scott.
on-
Or you could start at line 16 and delete everything from page 25, line 17, through the bottom of page 26. That would get rid of the whole thing.
This is about going to the court.
Yeah.
And that would allow the court to decide what the concern was.
Yeah.
What the proper,
So
Probably,
maybe
the
all
court
of,
would probably give an injunction to
all of-
make it behave.
just
All
all
right.
of D instead of D and E?
so is that a friendly amendment to the previous suggestion? that
All
we-
of D?
So
And-
it's
and is
strike
that what he's
all of
thinking?
D, which goes
Okay.
on to page,
Gotcha,
the next page.
gotcha,
So there is a motion, it was a friendly
yeah.
addition, discussion on it, discussion. All those in favor say aye.
Aye.
Those opposed, no. Motion is adopted. Did you get that one, Clayton?
And just to clarify one more time, we're starting from page 25, line 17, striking the remainder of the page, and then all of page 26, correct?
That's right.
No, I think it's only to line 12.
No,
Section
Mr.
D.
Chairman,
This, that is a different section.
different, you think that's different?
I think
Okay.
the appropriate place there, you can certainly strike more, but if we're just striking D, that goes to line
Okay,
12.
okay, that's fine.
Okay, we good, Clayton? Thank you. All right, anything else on line, excuse me, page 26?
I think that
Senator
really
Crum.
helps.
I'm not an attorney. I'm not an attorney or anything, but on page 25, line 13, I get back to this collection of debt again. It says, there's a sentence that starts, the facility shall not take any collection action against the patient or patient guarantor while a lawsuit is pending. Does lawsuit pending mean it's actually been filed, or it's, I'm thinking about doing it, I'm talking about doing
I
it?
think
And,
it's
and so my question is, if it's been filed, everything it just stops anyway, and while you're hammering out the issues. But if pending means I'm thinking about it, that's my question. What does the word lawsuit pending, what does that mean?
Senator Scott, also not an attorney, but very wise.
Mr. Chairman, my non-legal opinion is that you have to file the lawsuit for it to be pending.
Yeah,
Otherwise,
that's
otherwise
okay.
it's just speculative.
yep.
And what the court would do is, there's now a lawsuit, you cannot take any action, collective action, collection action. All right, thank you. Page 26, page 27. I think that, I'll just make a comment, excuse me. I think that the material violation under 35-905, a material violation of information, then, it's not a shall, it's a may, suspend, revoke a license. That's pretty drastic as well. So for this type of an issue, this is talking about an administrative thing, I believe in my mind, not a health and safety type of thing. So anyway, Senator Scott.
Mr. Chairman, that's existing language and would affect all the other provisions under that we don't
And we're
see.
just adding that in.
And would be appropriate for some of those.
Mr. Chairman, I'm not suggesting we strike that language from the statute. I'm just saying, is this a violation of this statute that we would put into law? Does it,
under that.
should there be that much of a hammer, suspend admissions, deny, suspend a license? Does it fit under those other 5 things?
Kind of like the
Seems like they would
governmental
be very
claims.
serious things. This, I don't know that this comes to that, rises to that.
Mr. Chairman,
Senator Scott.
it would work on the may place conditions upon a license. And I think that we can give some discretion here. That I think they would use that part of the discretion and would know better than to try.
Certainly.
Going too far
I just
beyond.
point out that some of the things in here are pretty significant, some
Yeah.
of the rest of it. So they do have discretion because it says may. All right, anything on the last page? Becomes effective immediately. I wonder about the effective immediately date. Let's see.
Except otherwise, Mr. Chairman, I think that July 1, 25 applies generally.
Yep,
I think 3 and 4 are rulemaking.
rulemaking, yep, thank
It's,
you.
it's the silly way that LSO has it done now.
Okay, thank you. All right, further discussion, any other amendments on the bill, discussion on the bill? Senator Cum.
Mr. Chairman, I very much appreciate transparency in where things are at, that we need to have transparency in our healthcare and in anything we do, whatever we do here at the legislature. I think we need to be transparent, but then at times I think we can become overburdening too. And I really, what's more important to me, I mean, transparency is important, but what's more important to me is rural healthcare. And we don't overburden hospitals and providers, which we know today are struggling to provide services to our communities. And all this, well, there is a little bit of benefit to this. I think the weight on our local providers, they're already providing this information. The little bit of additional information we get, I think, just puts too much burden on our small local providers throughout the state, which is a huge issue right now. So because of that, I do appreciate this, but I'm going to be a no vote on this bill because of the excess regulation that's put on our hospitals.
Senator Scott. Thank you.
Chairman, I'm going to be an aye vote on this because I think that the transparency is important. And I think this bill is, by talking about the dollars and cents, adding something significant to that. And I think it's, frankly, I think the bill's very well done by and large.
Further discussion, Seeing none. Clayton, would you call, roll call on House Bill 121 as amended?
Senator Crum,
No.
Senator Hutchings. Senator Scott,
Aye.
Senator Steinmetz. Chairman Barlow.
Aye.
Mr. Chairman, that is 4 aye and 1 no.
All right, and I'll be clear, if we hadn't taken out some of that compliance issues, I would have not been able to support this bill, so, some of that. So thank you, Representative Singh, we appreciate you. And if it survives on the floor, we might be in a conference committee. Thank you very much. Yes, Senator Hutchings. I'll let you two arm wrestle, and you let me know before it comes up on general file.
Okay.
All right, who will take that bill? Next bill up, I think I put 188 up, didn't I? 188. Representative Yin. Two families, one nanny. Representative Yin, welcome.
Mr. Chairman, thank you, Senate members of corporations.
Labor, Health, and Social
Labor Health,
Services.
sorry. Woo! Mr. Chairman, I have 2 committee videos open right now because I was chairing House Corporations to come here because other members of our Corporations Committee is also presenting bills in different committees right now. So members, my apologies, Senate Labor and Health. I bring before you 2 families, one nanny. This is a bill that came from a constituent that realized that she could possibly have been breaking the law. So members, we have requirements for childcare facilities, and there are a bunch of exceptions. So if you see in the bill, page 114.4.102, there's a list of exceptions. We don't have that list in the bill, but some of them apply to hiring a nanny to take care of a single family. But if, for example, I want to hire someone to take care of my own kids and my brother's brother, my niece and my nephew from my brother, that would require childcare facility licensing. I think that that is not necessarily required, nor is it, I think, the intent of our bodies to require licensing when it's just a couple of kids from two different families. And so that's really all the bill does. It allows for one nanny to take care of kids from two families. It puts a little bit of sideboards where we're talking about older kids, so it's not going to be for all under 2 years for infants. It's going to be for kids. And just making sure that that's legal and people don't have to get their nanny licensed by childcare. And with that, I'll answer any questions, but if there are no questions, I will run back downstairs to continue
Any
sharing.
questions for Representative Yin? Questions, for Representative Yin? So just to be clear, while the title says two families, one nanny, the bill language itself says multiple families. Is that accurate? Or do we need to amend the bill?
Mr. Chairman,
Representative Yin.
that's correct. I didn't want to exempt 3 families or 2.5 families, so but I wanted a catchy title, and I think that worked. But still allowing, 2 families with one nanny.
One fish, two fish, red fish, blue fish. Well done. Okay. All right. Anything else for Representative Yin? Thank you for being here. We'll take good care of your bill. All right. Are there any agencies here to testify on this bill? Agencies? Interesting. Oh, there's an agency or anyone else? Oh, she's coming up. Please introduce yourself and provide testimony. Thank you.
Mr. Chairman, members of the committee, I'm Nikki Anderson, Early Care and Education Unit Manager for the Department of Family Services. And I'm just here in the event you might have any questions of the department, so.
Department of Family Services, Ms. Anderson, thank you for being here. Any questions? Any questions? Senator Hutchings.
Thank you, Mr. Chair. Mrs. Anderson, quickly, the 2 family, 1 nanny, did you have any problem with the 1 nanny, 3 or 4 families at all?
Ms. Anderson.
Mr. Chairman, Senator Hutchings, we don't really have a position on the bill. I think that when Representative Yen talked about the guardrails, I think that's a good thing.
Thank you.
Thank you. Any other questions? Section 2 has rulemaking authority. Do you actually anticipate needing any rules?
Mr. Chairman, we don't.
Perfect. All right.
Mr. Chairman,
Yes, Senator Crum.
as you know, I'm new to this deal. Just trying to get clarification on a nanny. Does that include like a babysitter? Somebody has a babysitter over their house, they're going to a movie, say 2 couples, and they're going to a movie and they have their kids and their baby. Is a babysitter in that situation considered a nanny?
Mr. Chairman.
Go ahead, please.
Senator Crum, it would not. That's occasional care, and so they would already be exempt from being licensed.
Thank you.
All right. Very good. Thank you very much. Appreciate you being here. Any other testimony on the bill, agencies or otherwise? Is there anyone online for this one? Okay, thank you. Good afternoon. Please introduce yourself.
Good afternoon. My name is Micah Richardson. I'm with the Wyoming Women's Foundation. Our mission is economic self-sufficiency for women and opportunities for girls. And I just want to share that we are in favor of this bill as well. There was a situation in Du Bois just a little while ago where their sole child care facility closed. It would have been really handy to be able to bring in a couple of nannies to help with a few families, and they found themselves in a bit of a pinch. And so we just appreciate this. We appreciate that it is expanding access while not letting it get too off the rails. I think about when I have more than 4 kids at my house, and I'm about ready to pull out my hair. So we like that that is, that safety piece is included as well, and that is it. Stand for any questions.
Very good. Any questions for Ms. Richardson? Questions? Seeing none, thank you for being here. Further testimony on the bill. Further testimony on the bill. No one online. Closed testimony. Committee, any amendments in the bill? Motion, we'll go with Senator Steinmetz. And any amendments to the bill? Any discussion on the bill? Senator Steinmetz, I saw her reach for her mic. So there she go. Senator Steinmetz.
Oh, Mr. Chairman, just a notation that probably if they were homeschooling, it would be exempt already.
I don't know what the rest of the exemptions are, but maybe. Senator Scott.
Mr. Chairman, I think this bill largely legalizes what goes on anyhow, and prevents unfortunate instances where somebody tries to enforce a regulation that shouldn't be enforced.
Thank you, Senator Scott. Further discussion? Further discussion? If not, Clayton, please call roll on House Bill 188, 2 families, 1 nanny, as not amended, unamended.
Senator Crum,
Aye.
Senator Hutchings. Aye. Senator Scott.
Aye.
Senator Steinmetz.
Aye.
Chairman Barlow.
Aye.
Mr. Chairman, that is 5 ayes.
Very well. We have Senate colleagues who are sponsors on this. I'll touch bases with them and see if one of them wants to take it. If not, I can cover it. Actually, I'm not going to give them a choice. One of them's going to take it. Okay, the next bill for our consideration, House Bill 103. We have the good Representative Sherwood here to present this. Welcome. Good afternoon. Please proceed.
Thank you, Chairman and members of the committee. I appreciate your time and consideration. This is House Bill 103, columbarium regulations. When my constituent reached out to me with this issue, I had to Google, what was a columbarium? I was not aware. So just for clarification for the public who may be listening, it is a structure that has small compartments or niches that houses urns containing cremated remains. So it turns out that this is becoming a more popular option for citizens of Wyoming. And when the individual who manages my local cemetery brought me this issue, it was that the permit to construct a new columbarium in our cemetery had been denied. And not denied because anybody had done anything wrong, but because the statute that is currently in the books, that hasn't been updated since 1957, doesn't allow for modernization of construction. So upon further communication, we realized that there were other cemeteries in the state with a similar problem. So with that in regards, we decided to go in and just clean up and modernize some of the language without making it overly burdensome. So on page 2 of the bill, the bottom there, between lines 15 and 21, updates the language so that the exterior walls and roof of the structure right now are only limited to being able to use granite or marble, which we know can be very expensive. So we expand the materials to slate, sandstone, and so on, with the idea that we are still asking for structural integrity. So we still want the structure to last for many, many, many decades. We want it to be structurally sound and weatherproof. On page 3, lines 1 through 4, this is where we update the materials that can be used for the exterior doors of the structure. And then on lines 6 through 9, this is the interior materials that can be used. So we're still asking for something that is beautiful, that lasts a long time, but considers modern construction techniques that maybe weren't in place in the 1950s. So with that, I will answer any questions that you might have.
All right, questions? Oh, no, go ahead. He hit me and asked me to take over, so go ahead.
Well, I have a question.
All right, Senator Hutchings.
All right, Madam Chair. Representative Sherwood, welcome.
Thank you.
I know a lot about columbariums, and I have a mother in one that's the exterior, kind of here in Cheyenne. To me, it's not constructed well. The doors to the bodies are not, or the remains are not constructed well. It looks like a bookshelf with a plate glass in front of it. And I'm really concerned about my mother being in that, because someone can break in and kids vandalize that box at any time, or the boxes that are there. Does this bill affect those columbariums that are already existing?
Representative, go ahead.
Thank you so much for that question and that concern. The bill does not affect existing structures. And maybe that is unfortunate, but my understanding is that local cemetery districts should probably be notified. But that right now it is our Department of Health who provides the licensing for any new construction moving forward.
Follow up?
Thank you, Madam Chair. And this is just an FYI. Thank God the cemetery, they are building a new one. And just in case anybody wants to know, to move remains from one columbarium to the other, you have to pay about $2,000 to remove them, and then you got to pay again to get them put in a new one. So thank you for bringing the bill.
Thank you, Senator Hutchings. Are there further questions? Seeing none, thank you, Representative. Are there any agencies who wish to testify? Any public comments? Any public comment? Seeing none, committee, what's your pleasure?
Move the bill.
It's been moved by
Madam
everyone.
Chairman, there is one person
Oh,
online.
there's a person online, excuse me for that. We'll go back to public comment. There's someone online. Welcome to the Labor Health Committee. This is Darren Evans. Darren, welcome. Can you hear us?
Can you hear me?
Yes, Darren, go ahead. Please give us your name and if you're with anyone, and give us your public comments.
Yeah, my name is Darren Evans. I'm the superintendent of the Campbell County Cemetery District up here in Gillette. And I worked with Representative Sherwood and my colleague in Laramie, who runs the municipal cemeteries there, because we both run into the same problem, which she addressed with the permitting and the 1957 regulations that had never been modified. So I was just here to provide any background information, questions, or support.
All right, thank you. Committee, do you have any questions? Seeing no questions, thank you for taking your time to work on this important issue.
Thank you.
All right, so public comment is closed, and now we'll go back, and would one person move the bill? Senator
I'll
Scott.
move it. Oh, he's moved it.
Senator Scott gets to move the bill. And is there any discussion on the bill? Discussion, seeing none. Clayton, would you please call the roll?
This is a roll call vote for House Bill 103. Senator Crum,
Aye.
Senator Hutchings. Senator Scott. Senator Steinmetz.
Aye, and our good chairman is back just in time to vote.
Mr. Chairman, that is 5 ayes.
Turning it back over to you, Mr. Chairman.
Thank you. Well done, committee. Unscathed, thank you very much. So committee, we have 3 bills for Monday, and I think we just got assigned another one. The 3 for Monday will be, actually, Clayton, do you mind reading off the bill numbers and the titles for the committee, just so they can study them over the weekend? So I didn't give him any warning, so he's getting to them.
Yes, Mr. Chairman. The first to be discussed is House Bill 164. That is medical prescriptions off-label purposes. The second is House Bill 135. That is autologous or direct blood donations. And then the third bill is House Bill 96, which is prohibiting mask, vaccine, and testing discrimination.
Okay. Thank you. So those will be 3 bills for Monday, and then I think we have 2 bills left. And we may have gotten assigned a third one. Is there 3 left or 2, just 2, Clayton?
I believe 3.
Okay, sorry. I don't think one of them has actually appeared on the website yet, so, all right. So that's what we have for Monday. Thank you for your work this week, and have a nice weekend.
Thank you, sir.